So my name is Marilyn Arosemena, and I am one of the endocrinologists at the Texas Diabetes Institute. Where I'm originally from, there's a high Hispanic population, and there was a high incidence prevalence of diabetes. And that was one of the things that drove me. I realized that you can really make an impact in these patients versus other problems that sometimes are other diseases that are difficult to control. Diabetes, it's usually one that it's manageable, and you can make really a change in their quality of life. I think it's really important for the patients to know that as a doctor, I like to understand their background, where they're coming from, what are obviously their past medical history, and I really need to understand their social context because I think that's how we can really get to an agreement, decide what are the better medications for them, and then I do try to talk to them during our visit of things that small changes that they can make on their own. For example, if somebody has a super strict work schedule, I can tell them, just go for a walk for 30 minutes with your dog if you have a dog or a kid. So we always try to find like this small changes that ultimately make a great impact in patients' lives. My favorite thing about my job is that I get to talk to patients not only about their medical history, but usually we can really establish a good patient doctor relationship. So I get to know people from all backgrounds, different ethnicities, and I really get to understand what real life is from different perspectives. So I really like the communication between patient doctor, and I like to talk a lot. So I think that's a plus in my job. What makes me passionate on what I do, it's really the gratitude of patients, how happy they are after you're able to improve their diabetes, their thyroid problems, or other endocrinological problems, and also how we can really make an impact in their lives and ultimately get to a better controlled diabetes. You can see that patients get excited, and if patients get excited, then I get excited too. And obviously, we are really making an improvement in their quality of life, and that's ultimately why we're here for.